There are many great examples of schools working collaboratively and drawing on industry experts within their local communities to support students to be future ready. As safety, well-being and privacy are all essential components of high-quality patient care, it can be a challenge for schools to provide students with learning experiences that go beyond the theoretical and give them a real insight into the world of our healthcare providers.
Getting students from school into meaningful pathways in employment is what it's all about. And we know that the growth in the health sector is just booming. And we see this as a really great way for our students to get on board in the health sector and to get meaningful employment and to go out and make a difference in the world, whether that be in their local area here or back home in Cape York or up in the Torres Straits.
At Bentley Park College, we offer a Certificate 2 in Health Support Services and a Certificate 3 in Health Services Assistance. The collaboration between schools and industry is really critical in providing quality learning opportunities for students and helping us to raise their aspirations around the possibilities that are out there for them once they finish school.
So what we've been able to do is work with our local partners, work with our local PHNs, the health department, etc., to create our own industry, where students in Bentley Park College can aspire to go into the health industry. So in our training facility here, we're utilising the HoloLens to do that work. That allows students to operate in a real-life environment in augmented reality, because in the medical area, you often don't have access to a live hospital.
I've completed my Cert 2 for Health Support Services, and I'm working towards my Cert 3 for Health Services Assistance. And in the medical precinct here at school, we're able to play around with blood pressure being taught by teachers, as well as CPR and just general knowledge about medical terminology and how the equipment's used. A part of working in the medical industry is working with patients, and I'm able to transfer skills from school into that industry. After I complete grade 12, I aspire to study dentistry.
So when we're doing the hands-on experience in the medical training precinct, we also learn about hygiene, how to take care of yourself and patients properly, and a lot of area around hazards, how to identify them, how to resolve them. In the aged care facility, I love being able to just be there, help them. If you have one-on-one sessions with them, you learn a lot about them, about their lifestyle, and about, what they've done leading up to now. And it's just really comforting for them and for you, and it just makes it so much better.
We want other schools to utilise the great resource that we have here at Bentley Park College and the medical training precinct and the trainers that we have. We've got students attending this school from just about every community in Cape York and just about every island in the Torres Straits. And we're hoping to inspire those students to one day come through our medical training precinct, get the health qualifications they need, and if they want to, go back to their own community and to work in their own clinics that they've got up in the Cape.
Since the establishment of our health program, we've seen student interest grow rapidly in health careers. One of the things that's been really rewarding to watch is students that have previously not been engaged in school finding their passion. So seeing students that are not attending regularly, engaging in training during their own school holidays in the health sector, because they suddenly realise that this is their future. That's been fantastic.
At Kawana State College, we're really passionate about ensuring that every child reaches their full potential. We are so proud of the pathways that we have made for our students. Our pathways are legitimately allowing our students to find success when they leave this place.
I would like to continue to go to university, but I reckon I would start at nursing and then work my way up to radiography or being a naturopath. When I first went on my placement for my Certificate 2, I went into a chiropractor, and they had a radiographer there, and they also had a naturopath. It's actually given me a lot of confidence, and it's given me insight to how to deal with different scenarios. It's just helped me enhance my communication skills to all different people.
One of the highlights of the program has been seeing an increased enrolment in university post-schooling with our students. They have used the program to earn their AIN qualification so that they can continue to work in the field while they also do their university. It's also seen an increase in retention for a number of our students and QCE attainment.
When I graduate Year 12, I'm really interested in studying a Bachelor of Physiotherapy,
as I've really enjoyed learning about the structure of the human body and how it works. The practical aspects of this course have been really helpful. However, the theory and learning communication skills will be really beneficial in my career and working in the health industry.
So I'm currently studying my bachelor degree in occupational therapy. I got into it from when we were younger, and then later in grade 11 to 12, that door reopened and I wanted to pursue a career in allied health and especially in occupational therapist. In the future, I would love to be an occupational therapist or whichever health career route I would go into, but in the end, I do want to give back to my community.
I'm currently studying the Bachelor of Nursing at CQU here in Rocky. If I hadn't done this health course here at school, I wouldn't been able to get to where I am now. It was like a stepping stone to where I wanted to go. Having that background of knowledge from this course has helped me so much with my uni studies and at work as well.
I learnt that I love the industry, the health industry, and that I'm passionate to help people and that I look forward to studying my nursing.
I've learned that there's things I do and don't like, but I really enjoy the dementia ward. This program and the feedback received shows the compassion, the empathy that these students are able to provide to clients in a real life setting. Students are pockets of gold, and every child has the capability to learn. And I think when you change the learning and you bring that practical element to their lives, they rise to the occasion.
People are responding to the work that we're doing. They're wanting to be part of it. We're getting people contacting us all the time asking how can we be part of this agenda and this project. I'm proud of the fact that our students are ready to hit the workplace. They are qualified, they're knowledgeable, they're humble, and their integrity is second to none.
Creative and future-focused learning practices connect students with authentic experiences and schools with each other, supporting students to realise their potential. It's a collective approach that enables schools to create relevant, engaging learning experiences and ignite students' passion for possible future careers. How does your school form connections that support authentic learning and create positive transitions to meaningful pathways for all students?